What Arch Health did is they created a medical foundation to bring together a lot of physicians to work together. And by doing that, they created a model that they could advance care by bringing in even more subspecialized care.
We use a health network that allows us to see what other treating physicians are doing. We're able to communicate electronically, referring physicians. So referring physicians can get instant feedback to what the specialists are saying, how they're caring for the patients. So the communication is fantastic.
I enjoy being in this multi-specialty practice. It's very nice to be able to pick up the phone and contact a primary care provider, or even just walk down the hall and say, I think your patient has this, or thank you for referring them. It was a good idea. They need further evaluation of that lesion.
Having the resources that Arch Health Partners provides, we were able to start a new program and develop new treatments at Palomar Hospital that didn't exist before. And so the resources behind the foundation and the hospital have really been phenomenal to bring in the right physicians and staff and equipment.
It's very exciting. There's a lot of new technologies in sinus that we are implementing in our practice. In 2007, the balloon technique for dilating sinuses was introduced, and I was one of the first physicians in San Diego to begin using them. We've gained enormous experience over the last 6-7 years with hundreds of cases now performed.
I had a patient that presented with some puzzling rashes. She had been to some other locations and other physicians seeking treatment. She had been given several different creams. Nobody really listened to her symptoms other than giving her a quick glance over. And then she came to Arch. Her primary care physicians quickly picked up that this was more than just an ordinary rash that wasn't going to go away with the creams. They referred her to dermatology treatment, and we started the workup from there.
It's very enjoyable to help people. When people are sick, they're at the most vulnerable time in their life, and to be there and be a person that they lean on at that time, and to see their gratitude when they're cared for is very special.
Providers here, they really care for their patients. They're not just a factory pushing them in, pushing them out, doing just the minimal possible. These doctors care.
From our staff to our physicians, I believe that we have the motto that we want to treat people like we want to be treated.